Bula Vinaka, and welcome to Bula Wellness. I'm Dr. Alisha Sahukan, the Head of Health Protection with the Ministry of Health and Medical Services. Before starting this first episode, I would like to tell you more about what the show is about, which is to help you, the viewer, achieve and maintain health and wellness. There are a number of meanings for the word wellness or health, including the definition by the World Health Organization, which is the state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. But simply, it's looking after your body and mind by actively making healthy choices in how you live your life. And to help you live well, this show will look at the biggest threats to health right now in Fiji, what the Health Ministry and others are doing, and most importantly, what you, the viewer, can do for your own health. In today's episode, we will talk about the meningococcal C outbreak, which is better known as Men C. This will be the first of a two-episode story, with the second focusing on Men C immunization program. But first, we go to the streets to see what you, the public, know about Men C.
Meningococcal is a bacterial disease, bacterial virus.
Meningococcal is a rare but infection, bacterial infection.
Men C is meningococcal. It's everywhere spread in the world.
Men C is meningitis bacterial infection.
Using same cover balls and everything.
It's faced through like exchanging of salivas, like using the same spoon.
Okay, it's spread through saliva, transfer of body fluids. If you sneeze and you don't clean your hands or wash your hands, then it can be passed through all furniture and everything that you touch, basically.
Everything you touch.
Kissing.
For 1 year to 19.
It's from 1 to 19 years of age.
From 1 to 19?
I would say 1 to 19, 1 to 20, something like that. I would say that'd be the best age to be immune to, try to be immune to this sort of thing.
So interesting views there from the public. To help us know more about Men C, today I have invited some experts to join us here in studio to help us understand this topic better. But before we meet them, let's go for a short break. Welcome back to Bula Wellness. In studio today, we have Dr. Angela Marianos from the World Health Organization and Dr. Elisapedi Vereti Tuimbenga, Head of Department of CWM Hospital's Children's Department. Firstly, we had a lot of interesting answers from the public there. So Dr. Angela, could you, for the benefit of the viewer, could you just tell us what is meningococcal C or Men C and how serious is it?
Okay, thank you for that question. Meningococcal disease is a disease caused by bacteria that can affect both the brain and cause meningitis, or it can become a bloodstream infection and cause what we call meningococcemia. Both of these infections are extremely serious infections, and both unfortunately can rapidly result in death if they're not properly treated with antibiotics. Meningococcal C is one of 5 serogroups of meningococcal disease that can affect humans, and the other serogroups are serogroup A, B, W135, XY, and meningococcal C, of course, is the one that is currently circulating in the population in Fiji. The ways of preventing getting infected with meningococcal disease and meningococcal C in this particular instance is really trying to prevent the spread of saliva, because this organism, this bacteria, is actually found in the back of the throat of people, some of which don't experience any symptoms, and we know that between 1 and 2 out of 10 or 10 to 20% of people can carry this bacteria in their throats and remain perfectly well. In a small minority of people, that bacteria can enter the bloodstream and then cause meningococcal disease. The people that are at highest risk of then getting meningococcal disease are household contacts and people who are sharing saliva. So deep kissing, obviously it's occurring in partners, and also sharing of things like water containers or anything that can be contaminated with saliva. The ways of preventing this disease is really about hand and respiratory hygiene. So we really recommend that people wash their hands regularly, particularly after, say, coming into contact with the secretions of another person, for example, if they're looking after someone who may be unwell. In terms of respiratory hygiene, instead of coughing into your hand, we really recommend these days that people either cough into their elbow or cough into their shirt sleeve, because this then protects the hands and keeps them clean. And then there are the really important messages about anybody who believes that they may have meningococcal disease, who becomes ill, seek medical attention as quickly as possible.
Okay. What are our numbers in Fiji like compared to other countries?
In Fiji this year, and in fact since the beginning of last year, in Fiji since 2017 there has been an increase in the number of cases of meningococcal disease, and particularly most of the cases have been caused by meningococcal C, Men C. In this regard, Fiji reached an internationally agreed threshold above which the evidence shows that there was actually an outbreak occurring. Hence the need for a comprehensive range of activities to actually both prevent and then contain the outbreak. And these include a suite of activities targeting people who may come down with meningococcal disease, so prevention, and they're the types of messages that we've just talked about in terms of preventing the spread of this bacteria. Then there are specific activities targeting patients themselves, and then the contacts of patients and the community at large. So in terms of people who seem suspected cases of meningococcal disease, urgent medical attention is really important, and that includes seeking care and getting antibiotics, appropriate antibiotics, as quickly as possible to prevent the severe complications and potentially death.
And some of the measures that you're talking about have come out of this task force that was set up right in the beginning of the outbreak, so at the end of February. So Dr. Ely, I know you're a key member of this task force as well, but as a clinician and a pediatrician who works at CWM Hospital, and you're seeing these kids every day, especially right in the beginning of the outbreak, was this something that you're used to seeing very often? Children with meningitis or with meningococcal disease? What was this like for you?
Around about 2007 to 2015, and even before that, we were seeing about 1 to 3 cases per year. And it wasn't so alarming, but in 2015 we saw a lot more children, and there was a documented 9-fold increase in the number of children that we were seeing, and hence we had to press on the bottom alarm and highlight that there was a problem occurring.
Yep. And definitely the pediatrics department at CWM was one of the ones that really raised the alert that something unusual was happening, and that led to the formation of this task force. This is a very high fatality disease. Would you be able to tell us a bit more about why this is so and what the pattern it follows around the world?
So it is a very high fatality disease if it's left untreated. It's a disease, as we said, that causes meningitis, which is inflammation of the lining of the brain and the spinal cord. And in addition to that, even more serious presentation is when it enters the bloodstream and people get a generalised infection with this bacteria. And again, if left untreated, that can result in 1 in every 2 people who are affected in that way dying. So it is a public health emergency as well as being an emergency for that particular patient. And that's why it's really important that people are aware of the symptoms and signs. And these include fever, headaches, neck stiffness, could include diarrhea and vomiting, general aches and pains and feeling unwell. People can slip into unconsciousness and people can develop the characteristic rash. Sometimes more difficult to actually diagnose these in babies because they won't necessarily complain of a headache and they won't necessarily have neck stiffness and all of the other symptoms. But certainly a floppy baby that is unresponsive with a high fever, parents should have a very low threshold for concern and seek medical attention. Yeah. Just generally, we don't want to wait. If you think you have this disease, you have to go and see a doctor as quickly as possible for a proper assessment and administration of antibiotics if the doctor feels that this is a likely case of meningococcal disease.
And Dr. Ely, as a children's doctor, you have seen some of these babies being brought in when it's been too late. So what advice would you have for parents? Children get sick a lot. I'm sure you know this. Most of the time they're very mild illnesses. What would you say to a parent whose child has some of these symptoms but they're not really sure about bringing the child to hospital?
As Dr. Angela has mentioned, the key to getting the appropriate treatment and at the right time is early presentation. So she's talked about the signs and symptoms that we should all be looking at and thinking seriously, could this be meningococcus? And if the answer to that is yes, we should be presenting ourselves and our children and our families to the nearest health center as soon as possible, because early presentation means early diagnosis and early treatment and less fatality.
Thank you, Dr. Ely, for that. We're going to go to a short break and then come back and talk more about what you can do to prevent yourselves or your loved ones getting meningococcal disease. Welcome back to Bula Wellness. In studio today we have Dr. Angela Marianos from the World Health Organization and Dr. Elisapedi Vereti Tuimbenga, Head of Department of CWM Hospital's Children's Department. Doctors, I'm not sure if we've mentioned this already, but who exactly is most at risk of getting meningococcal disease, especially during this outbreak in Fiji?
So this is actually a disease, unfortunately, of young people, infants, children and young adults, particularly the under 20-year-old age group. The other high-risk group is household contacts and household-like contacts. And household-like contacts include people living in dormitories and institutional settings where they effectively resemble a household. They eat and sleep together and are spending many hours of the day together. So that's why, we're particularly concerned about settings where people are in very close contact with each other and in the young, particularly the sort of under 20-year-olds.
Yes, and I understand that more than 90% of all of our cases this year are actually in the age group of under 19. So I think that really highlights that age group is really the most at risk. Dr. Ely, just to tell the public a bit more about what they can do to prevent themselves or their children getting this disease. I know that there is a meningococcal C immunization campaign that started way back in May and that continues today. Could you tell us a little bit about that vaccination campaign and basically things like is it free, who is eligible to get it, for example?
Yeah. So I guess the Ministry of Health and Medical Services, together with its partners, WHO, UNICEF, SPC, and others, have come together and agreed on providing vaccination for all our high-risk peoples, all the children and the adolescents. So we've chosen 1 to 19 years. And as Dr. Angela has mentioned, that's the high-risk categories. So we are trying our best to use vaccines to ensure that the children and the adolescents are protected so that they don't spread the disease. And as she has mentioned as well prior to this, that there's a good number of people, a very good percentage, that are carrying the disease, and they are called normal carriers. And they're walking around with the organism in their nose, and they're not aware of it. And so we have to protect the public from getting the disease, and hence the vaccination.
Okay, thank you. Dr. Angela, we'll talk more about the vaccination campaign in the next episode. However, we know that anybody can get meningococcal C. So why isn't everybody getting the vaccine for free?
Okay, that's a very good question. The reason why this particular age group, the 1 to 19-year-olds, have been targeted is, as Dr. Ely said, they're the highest risk groups, but they also are, particularly adolescents, are also the ones that have the highest carriage. So that means that they're the group that is more likely to have the meningococcal bacteria sitting in their nose and throat, causing no symptoms most of the time, but with the possibility of spreading from person to person in these high-risk groups and high-risk behaviours, as we've mentioned. So it's really important in the vaccination campaign to give the vaccine to the ones both most at risk of acquiring the disease, that 1% of people, 1 to 2% of people that go from being a carrier to actually developing invasive disease. But it also has a second benefit, and we call this population immunity or herd immunity. By giving the vaccine to the group that is most likely to be carriers and to spread the bacterium in the population, it also actually protects the people that are unvaccinated. So the under 1-year-olds, despite not being given the vaccine, are protected by the fact that their older siblings and the broader community in which they're living in, of young adults, are actually protected. And it means that they won't be able to transmit to these younger children. Likewise, the older generation is inherently less likely to get this disease, but again, they are also protected by this population or herd immunity that is generated by giving the vaccine with high coverage to the people that are most at risk.
Okay. Has this been done in any other country, or is Fiji one of the first?
Fiji is certainly the first in the Pacific, but there have been many outbreaks of invasive meningococcal disease, particularly in the African meningitis belt. So one of the things that WHO, UNICEF, Médecins Sans Frontières, which is the Doctors Without Borders, and the International Federation of the Red Cross got together in 1997 and developed this mechanism called the International Coordination Group for the Provision of Meningococcal Vaccines. And this group has put together a security stockpile of vaccines, meningococcal vaccines, injecting equipment, and antibiotics for emergency response in countries, initially really targeting the African meningitis belt. And between 2009 and 2016, this mechanism actually made available 20 million doses of meningococcal vaccine to 13 countries. So Fiji is actually the first country in the Pacific that has used this mechanism, this ICG mechanism, to procure meningococcal vaccines for the control of this outbreak.
Yes, and I can tell you personally that it was quite a lengthy discussion to actually get that released to Fiji, because understandably that stockpile is reserved for the African countries which have very huge explosive outbreaks. But we were very fortunate that we were able to get that supply from that stockpile. Dr. Ely, compared to where we started in the beginning of the outbreak, the end of February, how are you feeling now? with how far we've gone with the response to the outbreak, including the vaccination campaign?
I must say we've come a long way and we have done a lot of things. Late last year, I just wanted to share this experience. I think it was November 2017. I had a 9-month-old child who came in and had the fever, the rash, had a bit of loss of appetite and diarrhea, and was referred from one of the outside health centers. And she didn't last more than 12 hours. We lost her early hours of the morning, came in the evening, lost her early hours of the morning. And I had a grandmother who said to me, please, doctor, explain to me why my 9-month-old, who was laughing and crawling and very healthy the day before, dies on you just within less than 24 hours of being in hospital. And at that time, I had said to her, this is not a new problem. We have seen this in the past, and we're noticing that there's a rise in numbers recently, and it is a problem because it can cause a death very quickly. And yes, I understand your child was very healthy yesterday and is not well now, and you've lost her, and all I can say to you is that this is a very serious and a lethal disease. So I hope she's listening in to this program today, because I promised her that we would make awareness out of this problem. And we have come a long way. The Ministry of Health, again, with all its partners, have created so much awareness on this problem, and we've also ensured that treatment is available right down to the subdivisional hospitals and even further. We've provided prophylaxis for families and those who have come in and have gotten treated. And we've done this major vaccination campaign that not many countries in the world have done. And I guess we've reached national, global numbers for an outbreak, and hence we've qualified to say that Fiji needed mass vaccination. And apart from that, we've done many other things, and so yes, we have come a long way from many years ago till now.
Thank you, Dr. Ely, and thank you, Dr. Angela. That brings to the end our show today. Before we leave you with this message that if you have a child between the age of 1 to 19, please ensure that they are vaccinated during this campaign. The vaccine for meningococcal C is just for that one serogroup, so we do encourage you to take note of the early signs and symptoms of the disease, as your child could develop the other strains of meningococcal. In next week's episode, we will look at the Men C immunization campaign that started in May this year in response to the outbreak. That and more in our next episode. Until next time, thank you for watching.